Yeah, well, the CHAMPION study demonstrated the value of pulmonary artery pressure guided heart failure therapy. But a question arose, and that was, did it add incremental benefit on top of guideline-directed medical therapy? That is, could we really reduce the risk of morbidity and mortality in patients who are already very well treated for their heart failure? The primary findings of this analysis of the CHAMPION trial demonstrated a 43% reduction in the risk of heart failure hospitalization and a 57% reduction in the risk of all-cause mortality in heart failure patients with reduced ejection fractions receiving guideline-directed medical therapies once managed using knowledge of pulmonary artery pressures. Yeah, so the CHAMPION trial evaluated the CardioMEMS HF system, a pulmonary artery pressure sensor that can deliver to the physician on a day-to-day basis pulmonary artery pressure. And the trial was a randomized controlled trial. All patients were implanted with the device. Physicians had access to the pressure information in half the patients, and they used it to manage the patients. Adoption of the system by the patients was fabulous. Patients reliably used the system, took their measurements on a day-to-day basis. Yeah, the take-home message of this analysis is that pulmonary artery pressure guided therapy using the CardioMEMS HF system adds value, substantially reducing morbidity and mortality in heart failure patients with reduced ejection fractions who are already well treated with guideline-directed medical therapy.